Alexis, my daughter, was born 26 week, 6 days, nearly 3.5 months earlier than the due date. She had a lot of medical conditions. She was diagnosed with BPD, chronic lung disease. Alexis didn't seem to be able to get off her oxygen support despite, growing quite well.
I was really seeing her breathing very hard, very deep. So I actually carried her. Her chest was bouncing against my chest. No such small baby can breathe so hard. I can feel it. She still need her condition need to be treated in the hospital.
We basically kept ourselves for that year. I think it was made harder based on the fact that it was peak COVID period. Therefore, it was even more important that we actually did get support from the hospital team. It's really the love and care I can see that the team and sisters who had for my child, especially when she's been in the hospital for so long. So it's really touching to see how much they love my child. Alexis is right now, she's 2.5 years old. She's the cheekiest girl you ever see. She was always having a brightest smile you can ever see on her face, and generally she's a very independent and strong girl.
I went, hey Yiqing, you see there's this family needs help. Will you be able to talk to them, or they can ask you some question if they want to. That's something that I'm very grateful to you, as well as Justin, because two of you really give my patients the great support. The support is continuous. Thank you very much.
Sister Suha and Prof. Zubair and the whole team, we are really grateful for everything that you've done for our child, our baby. It's never a given that she would have survived. So we are forever grateful to everything that you have done.
It was in 2003 that I experienced symptoms such as fever, drastic weight loss, and I was easily bruised. When playing soccer or running, I could see that there's lots of red spots on my leg, and I decided to go to the doctor, and the doctor said that it seems like your blood is something wrong, so you have to go to an A&E immediately. And that's where they saw that my white blood cells were very high. And they decided to do further tests, and they did a BMA on me, and then it was confirmed that I had ALL.
Being a teenager, you become more rebellious and difficult to accept treatment. Like for example, one time that we asked you that you are going for high-dose methotrexate, and then you have to drink lots of water, and then it was like a challenge and you refuse, you go for your exercise, playing football maybe for 3 hours and then come dehydrated and have more kidney problems.
Well, I remember that day very clearly, doctor, when you came to my bed and you gave me a really strong pep talk, You said to me, Firdaus, if you don't drink water, you're going to die. This is toxic in your body. And I made that strong will to summon my courage and to force myself to drink water.
For you at least you were willing to listen and then to work with us. I remember Sister Laura and all the nurses take you as their child. What are you doing nowadays?
I'm a father, and I'm also taking care of my mother as well. Being a son, being a father, being a husband to my wife, I think this itself, it's a gift. The responsibility is a gift.
You were treated under the Malaysia-Singapore 2003 treatment, something that we designed in Singapore in NUH, and then we applied it to the world. And the results now showed that with that treatment, higher risk leukemia like yourself is curable. Now, as we keep on developing new treatment, how would you encourage parents and patients at least to participate in this form of research to improve care?
Be open towards new developments in the treatments. I'm very sure that if they are seeking treatment, especially here, they are in safe hands.
After subsequent patients that we had with leukemia that we needed to do a bone marrow aspirate, they all refused, and we have to either call your dad or you to come and speak to them, and Somehow you just sit there and they say, okay, that's really quite fun, because I think that trust that they see from a child or person who have undergone the treatment and could tell them what it is matters a lot for them.
And I look forward to the many years of being part of your journey to help more cancer patients to understand the treatments here better.
I remember you distinctly with your running. You were running.
Yes, correct.
So was it secondary school or primary school?
It was secondary school, because at the time there was cross country. Then after that, that's when I had the rhabdo. After that, I had to do dialysis for about 2 years. And then transplanted in 2010. So now will be like coming 12 years in December already.
Really 12 years.
Yeah. So time goes by quite quickly.
You were rather brave, I must say, in a lot of things that you did. The main thing that really was a problem at the beginning was the running. That was the one thing that I knew you wanted to do, and yet it made your kidney worse, you see.
Yeah.
So we had to come to a compromise with our parents at one point.
I guess what inspired me to come back to work in the hospital, going for the camps, like early on, I kind of get to see, at the end of it all, what like real care for people is like, not just like the medical part, but I see all the people growing up and everybody like doing well in life in all the different areas, like getting married, having children, and I thought that it's something that I want to be part of also.
I always thought you were the physics guy.
Yeah.
I didn't expect you to do medicine, you see. Then suddenly one day you said you're going to do medicine, and that surprised me, because I thought you were an engineer, physics kind of person all the time. Okay. So it was a pleasant surprise when you said you want to do medicine.
Just wanted to thank you for taking care of me and everybody else over these many years, and the sacrifices that you all have like done for us, you and the department. And now working on the other side, working with you in the hospital, I can really see the amount of effort that goes into taking care of each person as an individual. I think I'm a big part of who I am today because of your care.
I think you know our philosophy, you cannot just end with giving medicine. You really got to end with the child growing up. Okay, and being able to live his dream, you see, whatever that dream is. So we need to be a part of that, you see, to help the child achieve that dream. I hope that that you will continue this tradition for the future, that we can continue to do this for future generations to come after I retire.